if you're on my email list, I sent out an email last week talking about knee pain and what would you do if your client, or what do you do when a client comes in with knee pain, specifically patella tendonitis or something like that. So I wanted to give you a recap of the kind of thought process I go through and how I help that client. So first, talk to them about the causes. So what causes the knee pain? If there was a specific incident that caused the knee pain, an acute injury or something like that, that's going to be treated a lot different than if it's just kind of gradually gotten worse or progressively gotten worse. And then also not what caused it specifically, but what movements, patterns, what ranges of motion, what exercises cause the pain, how long does it last after you do those, does it hurt when you've been sitting down for a long time, does it hurt when you've been standing for a long time, does it hurt when you're squatting, when you're lunging, etc. Does any exercises make it worse? Do any exercises make it better as you go? Things like that. So what are the causes? Second thing is, what is the type of pain? So again, this goes back to more of is it kind of an acute injury where something happened and it's like a sharp pain, or is it more of like a burning pain, which is kind of more of an inflammation type pain? Is it just kind of a dull ache? Things like that. So those kind of give us some ideas of what what type of injury it is. And then next is the mobility assessment. So after we've talked to them and kind of gotten a good idea of what they're experiencing, then we go into the assessment and we look at mobility first. So things we would do is basically the two main things for this one specifically is seated heel to butt, where your shins are on the ground, feet are flat, and you sit back onto your butt. Do you have pain in that position, in that full knee flexion position? Obviously it's not loaded, so do we have pain just in that position? Is it a stretch? Do you feel it in your quad, or do you just feel it in the patella tendon right there? Next is going to be the prone heel to butt, so laying on your belly, passively pulling the coach, you yourself is pulling your ankle, your heel to your butt. Do you have pain in that position? Do you feel it more up your quad, more into your hip flexor on that? Do you have any hip shift during that movement? Anything there? Any kind of ankle, and we look at ankle mobility because this could be a problem with the knee. So do they have full ankle dorsiflexion? And then we may look at their squat as well as kind of a mobility piece, not as much as a actual exercise and a quality of movement, but just do they have mobility in that position. And then from there we start designing the training. So we don't need to do much of depending on what causes it and what exercises cause it, assuming that most exercises cause the pain, we don't need to do necessarily any strength assessment, because if they have pain during a step up, if they have pain during a squat, they have pain during a lunge, then the strength on those movements isn't necessarily going to help us that much because we're going to stop when pain occurs. So designing training, first thing to think about is we want to get them in a pain-free range of motion. So that may be a very limited range of motion, depending on where they're coming from, but we want to get them in a pain-free range of motion. Not only physically is that going to be better for them, but also mentally that's going to be better for them. So if we have them training in a pain-free range of motion, then it helps build confidence in their movement. So you may have somebody who says they can't squat, they're not going to be able to squat, they have bad knees hurt when they squat, etc. Well, if we can get them doing just a short little mini quarter squat pain-free, then that's the first step in moving them in the direction of getting them to a full squat pain-free. So that's top priority. Next is this kind of triage of going from isometrics to controlled eccentrics and then strengthening through a full range of motion. So I would want to load in an isometric fashion first. If you have any experience with physical therapy or anything, the first thing to do after knee surgery is basically isometric quad contraction. So sitting on the table, your legs straight out in front and just isometrically contracting that quad, and that's just an isometric. So something like that, and then slowly getting into eccentrics where we're doing a slow eccentric with a load. So specific exercises that I might use to start is going to be like a step down. So we may be, if depending on how bad the knee pain is, it may be standing on the flat ground with your other leg out in front. I'm sorry, I'm not in a position to be able to demonstrate this right now, but you may just be doing a little, like I said, very small mini squat. Basically, if you're familiar with the PT world at all, that terminal knee extension, so just that very end range of knee extension. So the farther you stick your leg out in front and tucks that heel down, the more range of motion that's going to be, with just a short down and up, pain-free range of motion mini squat. That would be one way of doing it. You could also do a cyclist squat where your heels are elevated, and again, you're loading that tissue. So we want to load that tissue, again, assuming it's patella tendonitis type sensations, kind of that dull burning sensation on the front of the patella tendon is what we're talking about. We're not talking about any other kind of injuries right now, just this specifically, where we want to load that tissue, get a bunch of blood flow in there, and do slow eccentrics, isometrics, where we're really healing the tendons and the joint around that. Another thing that I just kind of thought about when you're doing this may be someplace where it's appropriate to do the voodoo floss on the knee. So you may start your day with voodoo floss, wrap them up, and accumulate like 50 squats, whether that, again, pain-free, so it may be mini squats, but 50 reps or so, which is gonna get a bunch of blood flow in there. Take those off, blood flow is gonna pool into that area, and then that also desensitizes the area, so the pain is gonna be a little bit less, so you may can do a little bit more after you do that. And we want to focus on load and volume. So if you can load it, if you can do motions that you can load pretty heavily, whether that's a short step down and it's pain-free, adding load doesn't add any more pain, then go ahead and load it, which is gonna, again, get that tissue healthy. If you can't really load it, then you can do volume. Again, we want the muscles firing as much as possible and pain-free, so it may have to be done with volume. And so you may do 50 reps on each leg, or if you want to do just the pain-injured side, you can do that, but you might as well do it with pain both sides. So 50 reps of little mini step-up to get a big activation of the quad. Another good one here is, this is actually concentric exercises, but sled drags, or reverse walking. So you're getting that terminal knee extension, getting that quad contraction in the patella repeatedly, and getting a bunch of blood flow into that area. So reverse sled drags, moderate, focusing on starting with the toe and driving through that quad, toe to heel as you step backwards, and again, getting a lot of blood flow in there. So hopefully that gives you an idea of what I would do. Obviously not specifically the training design for it, but that's kind of the mindset I would walk through. And yeah, if you want, I can just reply to this and I can give you a more specific, layout of an example of somebody that I have, because I have a few clients right now that are in this situation, so I can give you kind of their structure that we're going through right now to help get them out of pain. Hope that was helpful. Let me know if you want more information like this. If you're not already on the email list on the Iron Sharp Fitness website, there's a coaching where I send you emails of case studies and scenarios like this to help with your coach education and the practical application of it. So love to hear from you. Let me know if this is helpful.